One of the biggest causes for heart disease and arthritis is root canals and infected teeth. And if you guys want to find out why, stay tuned because I'm about to explain why. Root canal. What is it? Why and how does it cause heart disease and arthritis? All right, let me explain. I made a pretty bold claim, but I'll try to explain the best way I could. Okay, a root canal, what is it? Root canal is a procedure to replace the pulp and the nerve in your tooth with an inert material. Okay, well, why do they do this? Okay, this is done usually because root and or nerve of your tooth is infected or inflamed. And the majority of the time, you will end up going to the dentist or the endodontist in order to fix your tooth, because your tooth will be in severe pain usually. Sometimes it doesn't happen that way. Sometimes they discover a crack in your tooth, a lot of decay that goes down too low. Through x-ray, maybe they discover you have an infected nerve, infected root of your tooth. But there's various reasons. With a quick Google search, you can find some of these reasons quite easily. So how do these things cause heart disease and arthritis? Well, basically it goes back, I'm gonna have to take you back a little bit to a man named Weston A. Price. Now, Weston A. Price was a dentist back in the early 1900s, and he wasn't only a dentist, he was also a researcher. He was well respected at the time. He was the chairman of the American Dental Association, the research section of it. And, he founded actually the research section of the American Dental Association, and then he was the chairman from, I believe, 1914 to 1928. So this guy, this guy's a heavy hitter. He has a lot of accolades. I'm not even going to go into those things because it's going to take too long, and you probably don't want to know anyways. But anyways, he's the one that discovered the things that I'm telling you right now. And the way that happened was he himself used to perform root canal procedures on patients. And he would always wonder, do these root canals, do these teeth that are cleaned out of infection and filled up with gutta percha, which is the material they fill it with, do these teeth remain infected? Even though it was believed since back then that once they cleaned it out properly, they got rid of the infection, because they had a certain procedure that they would do in order to ensure that it was totally cleaned out. So he always wondered this until one day, finally, he had a patient come to him that she was suffering from debilitating arthritis. And he wanted to research this stuff, and he had an idea, and he told her that he wanted to, even though her root canal treated tooth looked healthy and looked fine, he wanted to remove it so he can study it. He wanted to see if he can find what was causing her illness, her degenerative arthritis. So he ended up removing her root canal treated tooth, and he took that tooth, even though it looked healthy and looked fine, and he ended up implanting it underneath the skin of a rabbit to see what would happen. Now, within, I think it was like 5 days or so, maybe 6 days, this rabbit ended up developing the same debilitating arthritis as this lady had. So he was really onto something here. Ended up dying, by the way, I think like by maybe a few days later, maybe it was like a week, but it died within a short amount of time after developing this debilitating arthritis. And my voice is kind of cracking there, like I'm going through a second puberty or something. Anyhow, another thing that happened that was very interesting was after he removed her root canal treated tooth, she ended up recovering from her debilitating arthritis. She couldn't use her hands because they were so badly debilitated. They were deformed a little bit. There's a picture in that book, the root canal cover-up that I just showed you, of her hands, and you can see the before and after. She couldn't even knit anymore. She couldn't, I think she was actually wheelchair bound. She couldn't even walk anymore. And then once he removed her tooth and she recovered, she was able to knit again. She was able to use her hands for little intricate things. She was able to walk again. I think she used crutches, and I'm not sure if she eventually got off the crutches, but she was able to get out of her wheelchair. So it was pretty amazing. That's one little story, but I mean, there's many stories, not just in this book, but there's many stories of people healing after getting their root canal treated teeth extracted from their mouth, right? But I do want to go into more detail as to why, because you're going to say, well, that doesn't really prove anything. That's just one person. Okay, well, here's what happens. I'm going to kind of go into detail, so you're going to have a little bit of patience, because it's pretty, it's not short, let's put it that way. Okay, so your tooth has these different layers, right? You have the dentin, you have your enamel, you have the cementum. Then, like I said, you have the root of your tooth where the nerves are, and there's the pulp that's inside. And then you have blood flow that actually goes from your gums and your jaw into your tooth through the pulp and supplies your tooth with nutrients. So your teeth are alive. You know, your teeth have a blood supply and a blood flow going into them. So depending upon what you eat, it will really determine how healthy your teeth are. You know, it's, you know, contrary to popular belief as far as, oh, if you just brush your teeth and floss all the time, you're going to have healthy teeth. They're going to be clean. They're not going to develop bacteria and all that. Well, it's not true. It actually is very dependent upon your nutrition. A big majority of how healthy your teeth are dependent upon your nutrition. But let me try not to get too off topic here about what I was about to explain. So you have these different layers your tooth's made up of. Your tooth seems pretty solid, right? But here's the truth. The truth is your teeth actually have these little holes. I mean, it's almost like a sponge-like material that your tooth is made of. It's porous. It has these little holes, and they're called dentin tubules. There's little tubes, right? And these tubes are basically, there's so many of them that if you connect them all together, they equal about 2 to 3 miles in length, just to give you a picture, you know, an idea how many of them there are. And you will only see them with a microscope because they're so tiny. But basically what happens is that when your nerves get infected or your root of your tooth gets infected, and the dentist or the endodontist goes in there, drills all the way down to your nerve, pulls the nerves out, disinfects the inside of your tooth, and then fills it with a substance called gutta percha, which is almost like a wax-like substance that they heat up and they push it in. They believe that your tooth is clean and you got to save your tooth and you still have it in your mouth, and now you can chew with it and you don't have a missing tooth and you don't need an implant, you don't need a partial denture, nothing like that, right? It's so great. Okay, well, what happens is what Weston A discovered, and other dentists like Hal Huggins and a few other dentists after his time, they redid this research that Weston A did, and he discovered that bacteria actually remains inside the dentin tubules. So they basically go inside these little tubes and they stay there, and no matter what you disinfect the tooth with, it could be doesn't matter what it is. I mean, it could even be ozone, because ozone is so powerful in killing bacteria. There will always be bacteria in these dentin tubules. So once they fill the tooth with the gutta percha, then they put the crown and you're all done. These things remain infected, and the bacteria just within 24 to 40 hours start multiplying like crazy. So what happens is there is people that will have these things in their mouth and they live a long, healthy life and nothing happens to them, right? I think that's in the book. It says about 30% of people are like that. You know, they have really strong immune systems. But the problem is a big majority of people, you know, it's not like that for them. They will end up developing anything from degenerative arthritis to cardiovascular disease, heart disease, stroke, kidney disease, eye disease. Basically, it can infect any tissue, any gland, any organ, and it can infect your joints as well. And this is all documented. It's proven. If you read this book, I mean, you can try to argue with me here. That's fine. But I mean, if you before you just try to argue it, go read this book. Also read this book. Read a few of these books. Do some research. And then come back to me and see if you want to still argue it. Because, I mean, this guy right here, the one that wrote this book, George Meinig, I think that's how you say his name, Meinig. He actually was one of the founders of the Association of Root Canal Specialists. So this guy, I mean, he was doing these things, he was performing root canals for like, I think over 50 years, right? Back to World War II time. And he ended up discovering, through Hal Huggins, he ended up discovering, I'll tell that story on another video, but he ended up discovering the work of Weston A. Price. He read the few books that, there was only one copy of, by the way, the original copy. He read a few books, and that Weston A. Price made about all this stuff he discovered. And I mean, this guy ended up feeling compelled to write this book. The research in this book is, I mean, the stuff he talks about and how he explains everything is a million times better than what I'm telling you. I'm just kind of like giving you a quick little overview of it, like cliff notes basically, if you will. But yeah, so these teeth that remain, you know, the bacteria remains, going back to what I was telling you, what happens is they harbor these bacteria, and these bacteria multiply and multiply and multiply. And the bacteria themselves, while they're bad, they're not super dangerous themselves. The dangerous part is these bacteria produce toxins, and these toxins are ultra poisonous, right? And these are the toxins that will basically travel through your bloodstream and infect, whether it's an organ, a joint, whatever it is, right? So that's why it's so dangerous. And the majority of the time, it infects the heart or the cardiovascular system. That's the main thing it infects. And I mean, come on, how many people die every year of heart disease? I just looked it up, and basically on the CDC.gov website, it says about 610,000 people die of heart disease in the United States every year. That's one in every 4 deaths. So I mean, it's the leading cause of death for both men and women. More than half of the deaths of heart disease in 2009 were in men. Okay, this is pretty crazy, right? I mean, these numbers are staggering. So it says coronary heart disease is the most common type of heart disease, killing over 370,000 people annually. Okay, so that's just nuts. So 610,000 people die of heart disease in the United States every year, right? Okay, well, let's see how many people. This is the American Association of Endodontists website. It's AAE.org, and it's talking about, it mentions in the first page right here, I believe it is, endodontic treatment statistics, okay? Well, I found this page. I don't know if that's the first page or not. But anyways, this says that, where is it at? Wow, look at that. It is estimated that 15.1 million root canal treatments were performed annually. And this is actually the statistics from 2005 to 2006. So 15.1 million. And then I don't know what the difference is with this, but it says it is estimated that 22.3 million endodontic procedures were performed annually. So, you know, some people have root canals already, and then they have it redone because it starts failing on them or something. But so think about how many millions of people, 15.1 million, get root canals annually. This is back in 2005, 2006. Who knows? That's already more than 10 years ago. So I wonder how many, you know, out of the 610,000 people that die of heart disease in the United States every year, how many of those were actually due to having root canal treated teeth? And or we're not even talking about infected teeth that are not root canal treated, but also harbor the same toxins and bacteria in the jawbone and go through the bloodstream, do the same exact thing that I'm talking about, or in the pockets where you've had maybe impacted wisdom teeth previously extracted, and you know those also become infected. They don't have to even hurt in that area. How many of those people actually died from that, from those toxins attacking their heart, attacking their cardiovascular system? And yes, I know nutrition's a big one. I know the way people eat also cause that issue. I know there's other various causes, but this one's a huge one that I believe is like almost like a secret, or almost it's like unspoken of. Even though it's known, it's documented, you just don't hear about it. You don't hear people discussing it. You know, even when it comes to the topic of nutrition, and people say they blame it all on eating meat, or they blame it all on, you know, yeah, that person, even though they were vegan, they had a heart attack because they ate oils. And I get that argument too, because that's true, you know, that can happen as well. But how many people actually die that wouldn't have otherwise of root canal treated teeth, since millions of people are getting them every year. So anyways, I digress, but to kind of get back on topic with these teeth staying chronically infected, you know how I mentioned earlier about your, the dentist or the endodontist basically removing the nerves inside the pulp. Well, you're actually, the tooth was already infected, and basically you should have lost your tooth already since then, right? But you're keeping it in your mouth and you're permanently killing that tooth. You're cutting off the blood supply to that tooth, so now it has no chance of recovering, even if it was already too far gone. But that's another topic right there. And you're cutting off the supply of oxygen and nutrients to that tooth. So if you look at each tooth almost like an organ, since it receives a blood supply, now you basically have a dead organ in your mouth, in your body, and that's the only place in the medical field or industry that allows you to keep a dead organ in your body, or a dead body part to keep it in your body. If you get frostbitten fingers, or if you get gangrene, they cut that thing off because you can die of an infection. But when it comes to teeth, it's not viewed that way, even though it can cause stuff that's just as severe, if not even more fatal. So something to think about. Let's see, what else? Yeah, so this a lot of this information can be found in these books that I just showed you, the root canal cover-up and the toxic tooth. But to kind of get back to the research that was done, Weston A. Price actually did 25 years worth of research, and I think it was, money-wise, it was worth back then to now would be worth like equivalent of a few $1 million worth of research or more. And it's basically, it's based on something called focal infection theory, and that theory was actually substantiated by Weston A. Price. He basically wrote a 1,174 page 2-volume body of research book. That's the kind of what I was talking about earlier. And the theory, though, the focal infection theory, was introduced in 1904 by Dr. Frank Billings. I just had to put it on the screen right here because I don't want to forget his name, but by Dr. Frank Billings. He's the one. And what is focal infection theory? So focal infection theory is where it's saying that an infection in one part of the body can spread to another part of the body. It can the way cancer cells metastasize from one part to another part of the body. Well, basically that's what happens in focal infection. But Dr. Frank Billings found out that like 99% of these focal infections that occurred, like if somebody had kidney disease or eye disease or lung disease, he found out that 99% of the time it originated from the mouth or from the tonsils, because the tonsils can harbor the same bacteria as infected teeth or root canal treated teeth or cavitations. So that's an important discovery because like I said, Weston A. Price ended up substantiating that information with all his studies that he did. And this stuff is major. I mean, I think this is probably one of the most important health discoveries in the last, few hundred years, of our time. But yet it's not spoken about. I mean, you can find some dentists, some endodontists, some oral surgeons, and people that know about this stuff. I mean, they're a little harder to find, but you could find them. These people are way smarter than me. I'm not even close to as smart as some of these people, and especially the guy that wrote this book, guy that wrote Toxic Tooth, a couple doctors that wrote the Toxic Tooth. But yeah, you can find people that know about this stuff. But anyways, this stuff is so important because how many people, not only die of heart disease or get debilitated by heart disease or cardiovascular disease or even strokes, but how many people, they just want to blame it on genetics, or they want to blame it on, I ate meat, maybe they're not even eating meat anymore. Maybe they hardly eat meat, but they're like, I ate meat when I was younger, so now I'm paying the price. I'm not saying those things don't have any kind of effects, right? Because we also know that eating too much meat can be bad, and we know the research from Dr. Doug McDougall and all these people that have shown that you can reverse heart disease through nutrition. But how much of that is really only because of the meat? And why are there people that can live to 90, 100 years old and they actually eat meat, or they eat kind of whatever they want? And people just want to like just dismiss it as, oh, they're just an exception to the rule. They're just special. I don't think so. I think that maybe those people happen to not have any kind of dental infections. Maybe they have really strong immune systems where they can actually handle and keep at bay these infectious toxins that are so poisonous to your system. There's different theories I have about that, but you know, this stuff's so important because how many people reach a certain age, maybe they're not even that old, and they get debilitating arthritis like that lady I was explaining to you about. You know, that's another important factor right there. And I don't think we need to suffer these things. There's so many people that end up getting these things removed and taken care of properly, and they get rid of whatever debilitating disease they had, you know, so there's hope. There's hope for these people. Back to the research of Weston A. Price. What he ended up doing, there was something called the rabbit studies, right? And I kind of mentioned how he implanted the tooth underneath the skin of a rabbit, but what he ended up doing to really prove that this is where these diseases were coming from, he took rabbit after rabbit after rabbit after rabbit with these infected teeth from different people. Let's say this guy had kidney disease, this person had eye disease, this person had, you know, heart disease, and he would implant their tooth, their infected tooth or root canal treated tooth underneath the skin of a rabbit. That rabbit would end up developing the same exact disease as that patient had from that tooth, right? He did this over and over and over again, and it would keep developing the same disease. If that patient had heart disease, rabbit would develop heart disease. That patient had kidney disease, that rabbit would develop kidney disease. Arthritis, right? So then what he ended up doing was removing the tooth from, because eventually the rabbit would end up dying. I think it would die within, most of the time it would die within a week or less they would die. I think there was only like one rabbit in the book that says that it lasted about 10 days because it was kind of a bigger, strong, aggressive rabbit, and it lasted about 10 days. But the moment that they implanted the tooth underneath the skin of that rabbit, it actually ended up becoming more docile and weaker, and it lost weight, and then it died. So these rabbits would end up dying very shortly, whereas humans, we can handle a lot more with our immune systems. But basically, he wanted to see that if he kept cleaning the tooth and using the same tooth and implanting it underneath various rabbits' skins, he wanted to see if the tooth would become, you know, the bacteria and the toxins would become basically less potent. So they thought, you know, Weston A. Price and some other people thought that after about 20 different times, let's say killing 20 different rabbits, that by then it would become way less potent and the rabbit wouldn't die anymore. But each time they did it, they believed that the rabbit's length of life would be longer. And what he would do, he would actually clean, after he would remove the tooth from underneath the skin, he would clean it, use a pumice stone to clean it and wash it, and then implant it again underneath the skin of another rabbit. But actually, the rabbit just kept dying within the same amount of time. The length of life did not go longer. It didn't get less potent. It stayed exactly the same. So that was also very profound. But I think total he used about 25,000 rabbits, and it just kept proving the same exact thing over and over and over again. So this is pretty significant. This research it's just something else, guys. This is insane. I mean, I don't see anybody talking about this on YouTube. Like, this is just not something anybody talks about. You know, I hear a lot of arguments with nutrition, which is great. That's very true. It's very valid. That's super important. I hear arguments, you know, about vegetarianism, veganism, all this stuff, which again, there's a lot of validity to that stuff too. But I don't hear anybody talking about this. This is like so important. This stuff is already proven. I mean, there's books written about it. There's still people suffering today, going to their doctor for medications, you know, having heart attack after heart attack. Sometimes they have multiple heart attacks, eye disease, kidney disease. Like I said, their joints are really bad. and their doctors can't really do much for them. You know, they give them certain treatments, certain painkillers, certain medications, but they're not really getting rid of the root cause. And the root cause, you know, root, pun intended, a lot of the times comes from the mouth. It comes from dental infections, cavitations. It comes from root canals, which is a chronic infection in your mouth, infected tonsils, right? There's also a story of a man that he also had arthritis, right? It was pretty debilitating, and he can actually initiate an arthritic flare just by grinding down or biting down really hard, because it would push the bacteria and the toxins into his bloodstream, and he was able to produce an arthritic flare. So that's pretty heavy duty stuff. Think about that. Another thing that I wanted to talk about or mention was people go and get their teeth cleaned. You know, they get their dental cleanings that they're supposed to get maybe every 6 months or every year. And, you know, they don't even think twice about basically pushing these toxins into their bloodstream via the gums. When they make the gums bleed a little bit through your dental cleaning, these toxins will go through the gums, and they can attack your organs, they can attack your heart, they can attack your tissues. So there's been stories of people that go get a dental cleaning, and then, you know, within no time, you know, a couple days later, they get a heart attack. You know, people don't connect the dots. So keep that in mind as well. It's very important. Another thing is antibiotics, right? We talk about antibiotics killing infections. Oh, I'll just take antibiotics and it'll just go and kill the infection. Well, with root canals, that's not the case, because remember how I said you cut off the blood supply to the tooth? So when you take the antibiotic, even though it's circulating in your bloodstream, in your system, it's not going to reach the tooth. It's not going to reach the dentin tubules. It's not going to reach any of that stuff. So that's kind of out of the question. That's not going to really help you. There's actually a way to see what bacteria you have, what toxins you have that are poisonous. A lot of the times it's the streptococcus. It's part of the streptococcus bacteria. But there's something called DNA connections. I'll put that on the screen right here. And the connections is with an X. But there's a test that you can send for, or you can go to a dentist that actually does this. But I think you get a piece of dental floss, and you're supposed to floss right in between, like where you have that root canal or possibly infected tooth. And you send in a sample to the lab, right? And when you send in the sample, you get a test result back that shows exactly which bacteria and toxins you have, and how basically it has like these bars that are colored, and it shows you, if you're in the red section, how dangerous they are. But we already actually even know which bacteria causes what issue. And we also know that test is great, because then you can actually, like, based on which bacteria and toxin you have, and you're trying to get rid of whatever degenerative disease you have or condition you have, you can find out which one you have, so you know what herb or what antibiotic to treat it with. And when I say antibiotic, it's after you get these things properly removed, because then you're going to restore blood flow to the bone after you get it removed properly, because you're going to get the tooth pulled, the ligament removed, and they're going to drill your jawbone a little bit, and then they're going to allow it to bleed for 5 minutes, which is about a teaspoon of blood, I believe. And then over the course of 4 to 6 months, I think your bone starts regrowing, since the oral surgeon or the dentist removes the ligament that connects your tooth to your jawbone. So once that occurs, you can actually, they can actually use antibiotic, I think maybe even on site, or you can take it right after they do the cavitation procedure, where they remove the ligament and pull the tooth and all that kind of stuff. So keep that in mind as well. I'm gonna have to make a second video about this topic, maybe a third video about this topic, because it's just way too long. But in a nutshell, or not in a nutshell, that was just way too long, not even in a nutshell. That's the reason why root canal and infected teeth or tonsils cause heart disease and arthritis, is because of the dangerous poisonous toxins produced by the bacteria that basically remain in the dentin tubules and inside these pockets, which can also be in your gums. So keep that in mind. If you're suffering right now, you have really debilitating arthritis for no reason, maybe you're kind of young and you have arthritis, different parts of your body, Maybe your fingers are already, becoming deformed a little bit, or your spine's getting twisted. Maybe you're older, you've had arthritis for years, and you've done everything you can. Well, maybe you may want to look into this more and find a holistic dentist that knows about these teachings that I talk of, knows about Weston A. Price's discoveries, knows about Hal Huggins, knows about the International Academy of Oral Medicine Toxicology, and knows about the DNA connections test. Look for that. Look for somebody that actually has a 3D cone beam CT scan so they can find these possible hidden dental infections. Maybe you don't have a root canal, but you have really debilitating arthritis. Maybe you have heart disease. There's a really good story in this book by Thomas E. Levy about his heart health, his cardiovascular health, and his heart health, and how he improved it by removing a old root canal he had, and then eventually removing his tonsils, because he couldn't get better after removing the root canal. He didn't know why, but he ended up figuring out it's because his tonsils were chronically infected. So you may want to check out that book as well. I would highly recommend checking out that book. And I'm just going to leave it there. So if you like my videos, go ahead and subscribe, like and subscribe. If you really enjoyed it, if you thought the information was worth listening to, go ahead and like and subscribe. And go ahead and hit that little bell button so you can be notified of when I post a new video. I'm going to try to post about once a week if I can keep up with that. I want to keep bringing you guys really good information for your health. And anyways, peace, love, take care, and I will see you next time.